Hi everyone, I'm Dr. Robinson with Synergy Chiropractic Center. I am a licensed pharmacist and a certified functional medicine practitioner. Last year, I made the transition from being a pharmacist at a local retail chain to building a business based on helping people heal with functional medicine. Now, I made this change mostly because in my other job, people just weren't getting better. And I was tired of standing by and watching. So I decided to do something about it. And now I'm on a mission to tell the world about how I used functional medicine to heal and why I think it's where you need to start on your journey to healing. Today I thought I would do my SIBO part 2 video. Now, in my first SIBO video, I told you all about my journey of getting a diagnosis of SIBO. And if you haven't watched that and believe that you might be struggling with SIBO yourself, I would encourage you to go back and watch that video first. So at the end of the first video, I was starting on my treatment plan. Now, there are several popular methods out there to get rid of SIBO, and the route that I chose to take was taking herbal antibiotics for 30 days to just flush out those bacteria. So I started with berberine and allicin, which are herbal antibiotics. When treating SIBO, there are often several different types of bacteria, so using more than one antibiotic is key. Now, I slowly worked my way up to the effective dose on both of those antibiotics, and everything was going well in the beginning, but by about 2 weeks in, I had to stop. At first, I thought I was experiencing die-off, which is pretty common. It's just a worsening of symptoms that can occur with starting antibiotic treatment. Now, I was starting to get so nauseous after each dose, and it just never seemed to go away. I was just nauseous all day and all night, and I was just exhausted and I felt sick. And after a little break from the constant nausea, it was back. And to say that I was discouraged was such an understatement. I couldn't imagine how I was supposed to take these antibiotics for a full month. I felt so bad. So I stopped them, and I happened to get a stomach virus while I was going through all of that. Now, why that happened, I'm not sure, but it was absolute torture for a few days. And so I took a different approach, and I stuck to a strict low FODMAP diet to try and kill off some of these bacteria and just calm my gut down. Now, this really helped my SIBO symptoms kind of get back under control. And I waited for about another 2 weeks for my body to recover, and I started antibiotics again with the diet that I was doing, but at a much slower pace. But the same thing happened. Halfway through, the nausea had worsened, and I was feeling exhausted again. So whatever was going on, my body was not dealing with it well. It was not doing well on this treatment. So I just did my best to stick to the diet while trying to explore my root causes of SIBO. Because as we know, SIBO is not a root cause set of symptoms. It occurs when other things in our body are out of balance. You might have heard this saying before, but healthy people don't get SIBO. So if you had this, or if you are treating for this, you should also be looking for other root causes. So I started to investigate what could be causing this for me, and I decided to just focus on my digestion and support it in any way that I could. Now, in general, there are several things that we want to focus on as far as digestion that can be causes or contributors of SIBO. So number one is a deficient migrating motor complex, or the MMC. Now, this is the series of contractions that your digestive tract uses to kind of keep the food moving. And if this MMC gets damaged, typically from an episode of food poisoning or a stomach virus, the MMC can slow down and it won't work as proficiently to kind of sweep those bacteria out of the gut. So that's number one. Number two is ileocecal valve dysfunction. The ileocecal valve is the barrier between the small and the large intestine. Now, if this isn't working properly, bacteria that are native to the large intestine can migrate up to the small intestine. Now, when bacteria are not in their right place, they start to cause problems. Number three is structural alterations to the small intestine. So this is anything that changes the structure of the small intestine, which can compromise its function and increase the likelihood of developing SIBO. Now, this could be from surgery, adhesions, or diseases that cause tumors or lesions like endometriosis, inflammatory bowel disease, cancer, or appendicitis. Number four on our root cause list is bile and enzyme issues. Having a sluggish digestive system in general that doesn't keep bile and enzymes flowing freely to digest your food will contribute to development of SIBO. Besides those, there are a few other contributing factors such as poor eating and sleeping habits, being immune compromised, high stress, and even medications like proton pump inhibitors that can decrease stomach acid and lead to SIBO. So all of those things need to be factored in. So learning all of this, at first I was overwhelmed. I had serious doubts that I was going to be able to figure this out. And in my state of sickness, after doing a few rounds of antibiotics, I remember just crying to my husband and saying, what if I never get rid of this? What if I'm like this the rest of my life? What if this is the mom that my kids picture? And obviously it was an exaggerated emotional response, but it was a serious question in my mind. So I had to keep reminding myself to continue praying and to recognize that there was a reason that I was going through all of this. So when I was, trying to figure out root causes, support digestion, I started with a gentle abdominal massage for my ileocecal valve and my small intestine, hoping that that would support those parts of my digestive tract. And to my surprise, I actually found that it helped. And I was doing all I could to support my MMC, that migrating motor complex. I started drinking dandelion tea to help with bile and enzyme flow, and all of this helped so much. And within a week or two, I was able to add some foods back into my diet and keep my SIBO symptoms under control. And this was just huge for me. I wasn't so stressed about what to eat. My digestive tract seemed much happier. Things had calmed down a lot. And I started to have energy and was exercising a few times a week again. But that nagging nausea was still there sometimes. And at this point, after all of this, I was thinking there may be something else going on. I was trying to remember the last time my stomach had really felt good. And it had been a while, more than a year for sure. But even before that, after I had my last child, which was 4 years ago, it never seemed like all my organs went back to their normal place. That together with some of my other symptoms, so thinking about that and having difficulty swallowing capsules sometimes, feeling like things were kind of getting stuck, and just having a low level of pain in my stomach all the time, I started to suspect what's called a hiatal hernia. And these are incredibly common, and I don't know why I didn't think of getting evaluated for that sooner, But, you know, everything happens for a reason. God always has a plan. So I went to see my chiropractor, and he adjusted my stomach in less than 10 seconds, pushing the top of my stomach back down through my diaphragm muscle, which that's all that a hernia, hiatal hernia is the stomach coming up through the diaphragm muscle. Now, it sounds crazy, but it was non-invasive, and I instantly felt relief. I could breathe better, and that nagging nausea was finally gone. And I truly felt like I got my life back. Now, I will need a series of a few other adjustments to retrain those muscles in that area. But seriously, I have not felt this good in probably 15 years. Now, it will be important going forward for me to continue to support my digestion, to get good sleep, to continue with optimal nutrition to prevent relapse of SIBO. But as it turns out, my symptoms were all connected. The hiatal hernia was part of it too. So it wasn't just as simple as fixing one thing or taking one medication or making one diet change. But I learned so much through this process, and I know that I needed to learn this knowledge by experience rather than just reading it in a book, so that I can help other people who are suffering with the same issues.